Question 1. The normal serum sodium level is A. 120 to 130 milliequivalents per liter, B. 135 to 145 milliequivalents per liter, C. 150 to 160 milliequivalents per liter, or D. 125 to 135 milliequivalents per liter. The answer is B. 135 to 145 milliequivalents per liter. Rationale. Normal sodium is 135 to 145, below hyponatremia, above hypernatremia. Question 2. A client has potassium level of 6.2 milliequivalents per liter. Which condition is the most likely? A. Hypokalemia, B. Hyperkalemia, C. Normal potassium, D. Hypocalcemia. The answer is B. Hyperkalemia. Rationale. Normal potassium is 3.5 to 5.0 milliequivalents per liter. More than 5.0 equals hyperkalemia. Question 3. The normal calcium level is A. 6 to 8 milligrams per deciliter, B. 8.5 to 10.5 milligrams per deciliter, C. 11 to 13 milligrams per deciliter, or D. 5 to 7 milligrams per deciliter. The answer is B. 8.5 to 10.5 milligrams per deciliter. Question 4. A magnesium level of 1.0 milliequivalents per liter indicates A. Normal, B. Hypomagnesemia, C. Hypermagnesemia, or D. Critical level. The answer is B. Hypomagnesemia. Rationale. Normal magnesium is 1.3 to 2.1 milliequivalents per liter. Question 5. Which chloride level is normal? A. 80 to 90 milliequivalents per liter, B. 95 to 105 milliequivalents per liter, C. 110 to 120 milliequivalents per liter, or D. 85 to 95 milliequivalents per liter. The answer is B. 95 to 105 milliequivalents per liter. Arterial blood gases. Question 6. Normal pH range is A. 6.8 to 7.0, B. 7.35 to 7.45, C. 7.25 to 7.35, D. 7.45 to 7.55. Answer B. 7.35 to 7.45. Question 7. A PaCO2 of 50 mmHg indicates A. Normal, B. Respiratory alkalosis, C. Respiratory acidosis, D. Metabolic alkalosis. Answer C. Respiratory acidosis. Question 8. Normal HCO3 negative range is A. 15 to 20 MEq per liter, B. 22 to 26 MEq per liter, C. 30 to 35 MEq per liter, D. 18 to 22 MEq per liter. Answer B. 22 to 26 MEq per liter. Question 11. Normal hemoglobin for men. A. 8 to 12 grams per deciliter, B. 14 to 18 grams per deciliter, C. 10 to 14 grams per deciliter, D. 12 to 16 grams per deciliter. Answer B. 14 to 18 grams per deciliter. Question 12. Normal hemoglobin for women. A. 12 to 16 grams per deciliter, B. 14 to 18 grams per deciliter, C. 10 to 12 grams per deciliter, D. 16 to 20 grams per deciliter. Answer A. 12 to 16 grams per deciliter. Question 13. A hematocrit of 50% in a male is A. Normal, B. Low, C. High, D. Critical. Answer A. Normal. Question 14. Platelet normal range. A. 50,000 to 100,000, B. 150,000 to 400,000, C. 400,000 to 600,000, D. 100,000 to 150,000. Answer B. 150,000 to 400,000. Question 15. Normal WBC count. A. 3,000 to 5,000, B, 5,000 to 10,000, C, 10,000 to 20,000, D, 20,000 to 30,000. Answer B, 5,000 to 10,000.
Renal function. Question 16. Normal BUN level. A, 20 to 40 milligrams per deciliter. B, 10 to 20 milligrams per deciliter. C, 40 to 60 milligrams per deciliter. D, 5 to 10 milligrams per deciliter. Answer B, 10 to 20 milligrams per deciliter. Question 17. Normal serum creatinine, male. A, 0.6 to 1.2 milligrams per deciliter. B, 1.5 to 2.5 milligrams per deciliter. C, 2.0 to 3.0 milligrams per deciliter. D, 0.2 to 0.5 milligrams per deciliter. Answer A, 0.6 to 1.2 milligrams per deciliter. Question 18. A creatinine clearance of 80 milliliters per minute is A, low, B, normal, C, high, D, critical. Answer B, normal. Question 19. Normal urine specific gravity. A, 1.005 to 1.030. B, 1.000 to 1.005. C, 1.020 to 1.050. D, 1.000 exactly. Answer A, 1.005 to 1.030. Question 20. Protein in urine is normally A, 0 to 8 milligrams per deciliter. B, 10 to 20 milligrams per deciliter. C, 20 to 40 milligrams per deciliter. D, always absent. Answer A, 0 to 8 milligrams per deciliter. Coagulation studies. Question 21. PT, prothrombin time, normal range. A, 5 to 10 seconds. B, 11 to 14 seconds. C, 20 to 25 seconds. D, 15 to 20 seconds. Answer B, 11 to 14 seconds. Question 22. INR for clients on warfarin. A, 0.8 to 1.1. B, 2.0 to 3.0. C, 3.5 to 5.0. D, 1.0 to 2.0. Answer B, 2.0 to 3.0. Question 23. APTT normal. A, 25 to 35 seconds. B, 10 to 20 seconds. C, 40 to 60 seconds. D, 5 to 15 seconds. Answer A, 25 to 35 seconds. Question 24. APTT therapeutic heparin therapy. A, 50 to 70 seconds. B, 10 to 20 seconds. C, 25 to 35 seconds. D, 70 to 90 seconds. Answer A, 50 to 70 seconds. Question 25. D-dimer elevated indicates A, normal finding. B, clot formation. C, infection. D, dehydration. Answer B, clot formation. Cardiac labs. Question 26. Troponin I normal. A, less than 0.03 ng per ml. B, less than 1.0 ng per ml. C, less than 0.1 ng per ml. D, less than 5.0 ng per ml. Answer A, less than 0.03 ng per ml. Question 27. CKMB rises in A, 2 to 4 hours. B, 6 to 10 hours. C, 12 to 24 hours. D, 1 to 2 days. Answer B, 6 to 10 hours. Question 28. BNP greater than 100 pgl suggests A, renal failure. B, heart failure. C, liver disease. D, stroke. Answer B, heart failure. Total cholesterol normal. A, less than 200 milligrams per deciliter. B, less than 250 milligrams per deciliter. C, less than 300 milligrams per deciliter. D, less than 150 milligrams per deciliter. Answer A, less than 200 milligrams per deciliter. LDL desirable. A, less than 100 milligrams per deciliter. B, less than 150 milligrams per deciliter. C, less than 200 milligrams per deciliter. D, less than 50 milligrams per deciliter. Answer A, less than 100 milligrams per deciliter. Liver function tests. Question 31. Normal AST. A, 0 to 35 UL. B, 50 to 100 UL. C, 40 to 60 UL. D, 100 to 200 UL. Answer A, 0 to 35 UL. Question 32. ALT normal. A, 10 to 40 UL. B, 40 to 80 UL. C, 80 to 100 UL. D, 100 to 200 UL. Answer A, 10 to 40 UL. Question 33. Normal total bilirubin. A, 0.1 to 1.0 milligrams per deciliter. B, 1.5 to 2.5 milligrams per deciliter. C, 2.0 to 4.0 milligrams per deciliter. D, 0.5 to 2.0 milligrams per deciliter. Answer A, 0.1 to 1.0 milligrams per deciliter. Albumin normal. A, 2.0 to 3.0 G per DL. B, 3.5 to 5.0 G per DL. C, 4.5 to 6.0 G per DL. D, 1.0 to 2.0 G per DL. Answer B, 3.5 to 5.0 G per DL. Question 35. ALP normal. A, 30 to 120 UL. B, 120 to 200 UL. C, 10 to 50 UL. D, 80 to 160 UL. Answer A, 30 to 120 UL. Question 36. Normal fasting blood glucose. A, 100 to 140 milligrams per deciliter. B, 70 to 110 milligrams per deciliter. C, 50 to 70 milligrams per deciliter. D, 80 to 120 milligrams per deciliter. Answer B, 70 to 110 milligrams per deciliter. Question 37. HbA1c goal for diabetics. A. Less than 6%. B. Less than 7%. C. Less than 8%. D. Less than 9%. Answer B. Less than 7%. Question 38. TSH normal. A. 0.4 to 4.0 MIU per L. B. 1 to 10 MIU per L. C. 0.1 to 1.0 MIU per L. D. 4 to 10 MIU per L. Answer A. 0.4 to 4.0 MIU per L.
Question 39. Free T4 normal. A. 0.8 to 1.4 nanograms per deciliter. B. 2.0 to 3.0 nanograms per deciliter. C. 3.0 to 5.0 nanograms per deciliter. D. 5.0 to 7.0 nanograms per deciliter. Answer A. 0.8 to 1.4 nanograms per deciliter. Question 40. Cortisol AM normal. A. 5 to 23 micrograms per deciliter. B. 10 to 30 micrograms per deciliter. C. 20 to 40 micrograms per deciliter. D. 1 to 5 micrograms per deciliter. Answer A. 5 to 23 micrograms per deciliter. Miscellaneous labs. Question 41. Uric acid normal in males. A. 2.5 to 8.0 milligrams per deciliter. B. 1.0 to 3.0 milligrams per deciliter. C. 5.0 to 10 milligrams per deciliter. D. 0.5 to 1.5 milligrams per deciliter. Answer A. 2.5 to 8.0 milligrams per deciliter. Question 42. Phosphate normal. A. 2.5 to 4.5 milligrams per deciliter. B. 4.5 to 6.5 milligrams per deciliter. C. 1.0 to 2.0 milligrams per deciliter. D. 6.0 to 8.0 milligrams per deciliter. Answer A. 2.5 to 4.5 milligrams per deciliter. Question 43. Amylase normal. A. 25 to 125 U per liter. B. 50 to 100 U per liter. C. 100 to 200 U per liter. D. 200 to 300 U per liter. Answer A. 25 to 125 U per liter. Question 44. Lipase normal. A. 10 to 140 U per liter. B. 140 to 200 U per liter. C. 50 to 100 U per liter. D. 200 to 400 U per liter. Answer A. 10 to 140 U per liter.
Question 45. Lactic acid normal. A. 0.5 to 2.2 millimoles per liter. B. 2.5 to 5.0 millimoles per liter. C. 1.0 to 3.0 millimoles per liter. D. 5.0 to 10 millimoles per liter. Answer A. 0.5 to 2.2 millimoles per liter. Question 46. Normal ammonia. A. 15 to 45 micrograms per deciliter. B. 50 to 100 micrograms per deciliter. C. 100 to 200 micrograms per deciliter. D. 0 to 10 micrograms per deciliter. Answer 15 to 45 micrograms per deciliter. Question 47. Digoxin therapeutic level. A. 0.8 to 2.0 nanograms per milliliter. B. 2 to 4 nanograms per milliliter. C. 0.5 to 1.0 nanograms per milliliter. D. 3 to 5 nanograms per milliliter. Answer A. 0.8 to 2.0 nanograms per milliliter. Question 48. Lithium therapeutic range. A. 0.6 to 1.2 milliequivalents per liter. B. 1.5 to 2.5 milliequivalents per liter. C. 2.0 to 3.0 milliequivalents per liter. D. 0.2 to 0.5 milliequivalents per liter. Answer: A. 0.6 to 1.2 milliequivalents per liter. Question 49. Theophylline therapeutic range. A. 10 to 20 micrograms per milliliter. B. 20 to 40 micrograms per milliliter. C. 5 to 10 micrograms per milliliter. D. 40 to 60 micrograms per milliliter. Answer: A. 10 to 20 micrograms per milliliter. Question 50. Phenytoin therapeutic range. A. 10 to 20 micrograms per milliliter. B. 20 to 30 micrograms per milliliter. C. 5 to 10 micrograms per milliliter. D. 2 to 5 micrograms per milliliter. Answer: A. 10 to 20 micrograms per milliliter. Hematology. Question 51. Normal red blood cell, RBC, count for men. A. 3.0 to 4.0 million per microliter. B. 4.7 to 6.1 million per microliter. C. 6.5 to 7.5 million per microliter. D. 3.5 to 4.5 million per microliter. Answer: B. 4.7 to 6.1 million per microliter. Rationale: men have higher RBC due to testosterone effects. Question 52. Normal red blood cell, RBC, count for women. A. 3.8 to 5.4 million per microliter. B. 4.5 to 6.0 million per microliter. C. 5.5 to 7.0 million per microliter. D. 3.0 to 4.0 million per microliter. Answer: 3.8 to 5.4 million per microliter. Question 53. Erythrocyte sedimentation rate, ESR, in women should be A. 0 to 15 mm per hour. B. 0 to 20 mm per hour. C. 0 to 30 mm per hour. D. 0 to 10 mm per hour. Answer: B. 0 to 20 mm per hour. Rationale: normal ESR is 0 to 20 in women, 0 to 15 in men. Question 54. Normal mean corpuscular volume, MCV. A. 65 to 75 femtoliters. B. 80 to 95 femtoliters. C. 100 to 120 femtoliters. D. 50 to 65 femtoliters. Answer: B. 80 to 95 femtoliters. Rationale: helps classify anemia, microcytic, normocytic, macrocytic. Question 55. Normal iron level in males. A. 80 to 180 micrograms per deciliter. B. 50 to 150 micrograms per deciliter. C. 20 to 40 micrograms per deciliter. D. 200 to 400 micrograms per deciliter. Answer: A. 80 to 180 micrograms per deciliter. Question 56. Ferritin normal for women. A. 15 to 150 nanograms per milliliter. B. 100 to 200 nanograms per milliliter. C. 200 to 400 nanograms per milliliter. D. 50 to 100 nanograms per milliliter. Answer: 15 to 150 nanograms per milliliter. Rationale: ferritin is the iron storage protein. Question 57. Serum osmolality normal range. A. 275 to 295 milliosmoles per kilogram. B. 250 to 270 milliosmoles per kilogram. C. 300 to 350 milliosmoles per kilogram. D. 200 to 220 milliosmoles per kilogram. Answer: A. 275 to 295 milliosmoles per kilogram. Rationale: indicates hydration status. Question 58. Normal triglycerides. A. Less than 150 milligrams per deciliter. B. Less than 200 milligrams per deciliter. C. Less than 250 milligrams per deciliter. D. Less than 300 milligrams per deciliter. Answer: less than 150 milligrams per deciliter. Question 59. High-density lipoprotein, HDL, good cholesterol, normal for men. A. Greater than 35 mg per deciliter. B. Greater than 45 mg per deciliter. C. Greater than 50 mg per deciliter. D. Greater than 25 mg per deciliter. Answer: A. Greater than 35 mg per deciliter. Question 60. High-density lipoprotein, HDL, good cholesterol, normal for women. A. Greater than 35 mg per deciliter. B. Greater than 45 mg per deciliter. C. Greater than 50 mg per deciliter. D. Greater than 25 mg per deciliter. Answer: C. Greater than 50 mg per deciliter. Therapeutic drug levels. Question 61. Valproic acid therapeutic level. A. 50 to 100 micrograms per milliliter. B. 10 to 20 micrograms per milliliter. C. 5 to 15 micrograms per milliliter. D. 100 to 200 micrograms per milliliter. Answer: 50 to 100 micrograms per milliliter. Question 62. Carbamazepine therapeutic range. A. 4 to 10 micrograms per milliliter. B. 10 to 20 micrograms per milliliter. C. 20 to 40 micrograms per milliliter. D. 2 to 5 micrograms per milliliter. Answer: 4 to 10 micrograms per milliliter. Question 63. Gentamicin peak level. A. 1 to 2 micrograms per milliliter. B. 5 to 10 micrograms per milliliter. C. 10 to 20 micrograms per milliliter. D. 20 to 30 micrograms per milliliter. Answer: B. 5 to 10 micrograms per milliliter. Question 64. Gentamicin trough level. A. Less than 1 micrograms per milliliter. B. Less than 2 micrograms per milliliter. C. Less than 3 micrograms per milliliter. D. Less than 5 micrograms per milliliter. Answer: B. Less than 2 micrograms per milliliter. Question 65. Vancomycin trough therapeutic level. A. 5 to 15 micrograms per milliliter. B. 10 to 20 micrograms per milliliter. C. 15 to 25 micrograms per milliliter. D. 20 to 30 micrograms per milliliter. Answer: B. 10 to 20 micrograms per milliliter. Question 66. Phenobarbital therapeutic level. A. 15 to 40 micrograms per milliliter. B. 10 to 20 micrograms per milliliter. C. 5 to 15 micrograms per milliliter. D. 40 to 60 micrograms per milliliter. Answer: 15 to 40 micrograms per milliliter. Pediatric and special. Question 67. Normal newborn bilirubin, 24 hours. A. Less than 6 milligrams per deciliter. B. Less than 10 milligrams per deciliter. C. Less than 12 milligrams per deciliter. D. Less than 15 milligrams per deciliter. Answer: less than 6 milligrams per deciliter. Question 68. Normal newborn bilirubin, 48 hours. A. Less than 6 milligrams per deciliter. B. Less than 8 milligrams per deciliter. C. Less than 10 milligrams per deciliter. D. Less than 12 milligrams per deciliter. Answer: C. Less than 10 milligrams per deciliter. Question 69. Normal newborn bilirubin, 72 hours. A. Less than 12 milligrams per deciliter. B. Less than 15 milligrams per deciliter. C. Less than 20 milligrams per deciliter. D. Less than 8 milligrams per deciliter. Answer: less than 12 milligrams per deciliter. Question 70. Therapeutic International Normalized Ratio, INR, for mechanical heart valve. A. 2.0 to 3.0. B. 2.5 to 3.5. C. 3.5 to 4.5. D. 1.0 to 2.0. Answer: B. 2.5 to 3.5. Rationale: higher anticoagulation is needed for artificial heart valves.
Thank you so much for watching. If this video helped you in your Nclex prep, make sure to hit the like button, subscribe, and turn on the notification bell so you don't miss the next study session. Share this with your fellow nursing students. It could be the key to their success too. Remember, success on the Nclex comes with practice, strategy, and consistency. Keep pushing, keep practicing, and you'll get there. This is Nclex Made Easy 91, and I'll see you in the next video. Stay focused, stay confident, and let's crush the Nclex together.